You can help to contain the spread of the coronavirus. Wear a mask, wash your hands frequently, physically distance, and download the We Health Bermuda app today. How does the app work? After a person is tested, if they are positive for the coronavirus and have downloaded the We Health Bermuda app, they will receive a code from the Ministry of Health. The person will enter that code into the app, and We Health Bermuda will anonymously notify other We Health Bermuda app users that an infected person was in close proximity, even if they don't know that person. Because the We Health Bermuda app does not use or collect personal information or track users' locations, these notifications will be completely anonymous. We Health Bermuda uses Bluetooth signals to measure how long and how close app users were together. Once you download and install the app on your smartphone, the app will run in the background and alert you to any exposure risks. It uses very little data or battery life and will continue to work if your phone uses Wi-Fi only as long as Bluetooth is enabled. We are using the power of technology to defeat the coronavirus. Download the We Health Bermuda app today. This message was brought to you by the Ministry of Health.
Good evening, Bermuda, and thank you for joining us this evening. Last week, the government was pleased to announce the beginning of our vaccination program, with the Ministry of Health beginning distribution of the Pfizer-BioNTech vaccine on Monday, January 11th, to elderly residents 80 years and over, the clinically vulnerable, frontline healthcare workers, and essential workers, such as police officers, teachers, and others. From my perspective, the first week has been extremely successful, and this success is thanks to the dedicated Department of Health staff efforts. I would like to thank Dr. Heather Armstrong, the government's senior medical advisor, and her entire team for their hard work in getting Bermuda's vaccination center established, running safely and efficiently. Tonight, I am joined by the Minister of Health, the Honorable Kim Wilson, who will give details of the vaccination program to date, including the number of residents vaccinated so far and details on changes to our travelers regime. Following that, I'll be providing updates on the current restrictions, additional matters when it deals with additional vaccine receipts, and also economic measures that the government is employing to stimulate the economy. First, we will begin with the Minister of Health. Minister?
Good afternoon. Today, there were 657 test results received by the Ministry of Health since the last update, and one was positive for COVID-19. The new case is classified as imported with details as follows. One resident who arrived on flight AA308 from Miami on the 17th of January 2021 and tested positive on their arrival test. There have also been 5 recoveries. Bermuda now has 684 total confirmed positive cases. Their status is as follows. There are 69 active cases, of which 63 are under public health monitoring and 6 are in hospital with none in critical care. A total of 603 have recovered, and the total deceased remains at 12. The mean age of all confirmed positive cases is 43, with the median 40 years, and the age ranges from less than 1 year to greater than 100 years. The mean age of all currently active cases is 47 years, with the median being 47 years, and the age range from less than 20 years, and that age group is from 10 to 19 years, to greater than 80 years, and that age group is from 80 to 100 years. The mean age of all currently hospitalized cases is 61 years, with the median age being 69 years, and the age range from less than 30 years, and that age group is from 20 to 29 years, to greater than 80 years, and that age group is from 80 to 100 years. The mean age of all deceased cases is 75 years, with the median age 77 years, and the age ranges from less than 60 years, and that age group is 50 to 59 years, to greater than 80 years, and that age group is 80 to 100 years. The source of all cases is as follows. 195 are imported, 472 are classified as local transmission, of which 392 are local transmission with a known contact or source, and 80 are local transmission with an unknown contact or source, and 17 are under investigation. As investigations proceed, transmission categories may change. Today's update has one case moving from under investigation to local transmission with a known contact or source. Of over the 150,000 test results reported, the mean age of all persons tested is 43 years, with the median 42 years, and the age range from less than 1 year to greater than 100 years. The 7-day average of our real-time reproduction number is less than 1, being 0.35, and Bermuda's country status currently remains at clusters of cases. I will now provide an update on the COVID-19 vaccination program. As the Premier mentioned, the Ministry started the distribution of the Pfizer-BioNTech vaccine on Monday, the 11th of January. And for the week of 11th of January to the 16th of January, there have been a total of 1,665 vaccines administered. 738 of those vaccines were administered by the Bermuda Hospitals Board during their first vaccination clinic held at King Edward Memorial Hospital, and the individuals vaccinated were part of our Phase 1A priority group as outlined in the Ministry's vaccine allocation strategy, and this included both frontline healthcare workers and residents in our hospital's long-term care facility. Of the remaining 927 vaccines, 40 were administered to the elderly, extremely clinically vulnerable, and clinically vulnerable at nursing care facilities, and 887 were given to the elderly and frontline health care and essential service workers at the vaccination center at the Police Recreation Club. More particularly, of the vaccines administered so far, the breakdown is as follows. 58% are female, 42% of male, and of this, 32% were essential service workers, 27% were health workers, 22% were not categorized by occupation, as they were normally elderly and retired, and 19% were other, as in retired, unemployed, or caregivers. As has been reported, when we initially opened the vaccination hotline, we were overwhelmed with the number of residents calling to express their interest to be vaccinated. As a result, we increased the number of staff to answer the calls and revamped the infrastructure for these staff. We also implemented an online form which allows residents to register their interest easily, efficiently, and conveniently. And I'm happy to report that the number of residents who have registered their interest to date is 7,729. The Ministry would like to thank those residents who have already registered and remind residents that registering your interest does not guarantee you an appointment at this time, as all submissions will be prioritized based on an assessment by our medical personnel. The breakdown of those registering their interests is as follows. 51% are female, 49% are male, and that is further broken down to 63% white, 14% black, 9% mixed or other, 14% race was not stated, and this was as the initial online form did not have this field for us to be able to collect the data with respect to race. For those residents who haven't registered as of yet but would like to, we recommend you using the online registration form, which can be found at forms.gov.bm/COVID vaccine. As I have said before, when you submit your registration form, you will receive an auto-generated submission receipt. Your submission will be kept on file, and you will be contacted as appointments become available. Every submission will be replied to, and there is no need for you to resubmit. We ask that people who registered, whether via the online form or by email, to please be patient as we work through all submissions and allocate the appointments. The process for the medical risk assessment is a manual one that's done by the medical team, and this, of course, takes time. At present, eligibility is a combination of age, medical history, and occupation. We are focused on those who are in priority groups 1A and 1B, but recognize that people can be in multiple categories and have multiple medical vulnerabilities of which are not evident to the naked eye. Following our initial allocation strategy, Group 1A includes people who are 80 years or older, care home residents, frontline health care, and frontline essential workers. Group 1B includes people who are 65 years of age or older and people who are extremely vulnerable, such as those undergoing chemotherapy or with severe asthma or COPD. During this first week, there have been many healthcare workers and frontline essential service workers who received the vaccination at the vaccination center. These were workers who were largely registered as a block through their place of employment, for example, the Bermuda Police Service. As we tackle the backlog of registrations received online or those emails which remain, we are moving our focus this week to increase the number of high-risk and elderly persons receiving the vaccination. As the vaccine has strict quality control standards and must be administered within a specific time period, we must closely monitor the doses administered throughout the day. So that you know, once it is thawed, the vaccine batch must be used within 5 days, and a vial, which holds 5 doses, must be fully used once opened and mixed. Our mandate is to ensure that we do not waste a single dose. On the question of some persons receiving the vaccine before others, as I have said before, the decision is based on a risk assessment done by the medical team and in accordance with the information provided by the resident. Bermuda does not have a registry that provides information on the persons with medical conditions that would help to validate all of the information received, and this means that we have to rely on self-reporting in cases where there is no doctor's note. As we get to the end of each day's vaccination session, we only have a limited time to administer the remaining doses. That is when we contact persons who are eligible for vaccination in Phase 1 and who can attend the vaccination center in a few minutes. This is how we avoid wastage. In the coming days and weeks, the ministry will continue to distribute vaccine doses at the rest homes and the long-term care facilities. We will continue administering vaccines at the vaccination center to those who match Group 1A and Group 1B profiles who have registered their interests. We are also in the process of identifying added opportunities to administer more vaccinations before the arrival of the next batch of vaccines. This will involve additional locations and or additional shifts. In short, we are seeking to drastically increase the number of vaccines we can administer daily and provide residents with more options to get vaccinated as quickly as possible. This increase in our capacity will also see us moving into Phase 2, which is persons 50 and older and vulnerable people, essential travelers, and specific groups such as the unsheltered persons, and eventually Phase 3 when we can offer the vaccine to everyone. The aim is to ensure everyone who wants to get vaccinated will get a vaccination. I also would like to spend a few moments to just briefly update you with respect to travelers. Starting on Monday, the 25th of January, travelers in different traveling continuum stages will be changing their wristband colors. So every traveler arriving will receive a red wristband upon arrival. And on day 4 testing, the red wristband will be changed to orange. And on day 8 testing, the orange wristband will be changed to a yellow. These changes in colors are related to the activities that persons should or should not do as they advance through their testing regime and incubation period. Travelers are reminded that there are very specific things that they cannot do until they are further into their testing regime. For example, no one should be visiting a bar or playing a contact sport until after their day 8 negative test. Examples of the different activities are provided on the traveler's first 14 days in Bermuda guidance for residents and visitors document, which is www.gov.bm/coronavirus-travelers. We hope the series of colored wristbands will help travelers know what they can and cannot do during their first 14 days in Bermuda. And finally, as we are beginning on our vaccine journey, and it is a journey, so continue to stay safe, Bermuda, and remember that I wear a mask to protect you and you wear a mask to protect me. Thank you.
Thank you, Minister of Health. And on behalf of the people of Bermuda, I want to thank you and your team for all the hard work of which you continue to put in on the front line of this pandemic. It goes without saying, and of course, it's often said from the Ministry of Health that this is a marathon and not a sprint. And persons should remember that the Ministry of Health and the team at the Ministry of Health have been running this marathon since last January, so coming up to a year's time. You can recall that I believe it was January 30th of 2020 when the World Health Organization said that this was a public health emergency of international concern. That is where we are almost a full year later. And the work has been incredible through scaling up of testing, managing various items, and now moving through to a vaccination program. The work that has happened is certainly excellent. And it is great news to understand that in the first 6 days of our vaccination program, last week, Monday through Saturday, as the Minister of Health indicated, 1,665 doses of the vaccine were administered. In addition, there were further 197 doses administered yesterday at the vaccination center. Over 7,700 people have registered their interest in taking the vaccine, and I am thankful to all those who have expressed their interest and have taken the necessary steps to protect themselves and to protect our community. Please, however, remember that we do have a system in place, and as the minister has indicated, that we are now prioritizing Phase 1A and Phase 1B. So if you are not in Phase 1, I would strongly and kindly ask that you do not yet register. I received a message from someone today who is a young, well, healthy person who is in their 20s. Right now, the Ministry of Health team is trying to make sure that they can continue to process, to assign, and to ensure that we're able to treat the priority groups first. When we are able to move to Phase 2 and to Phase 3, the notifications will be sent. But registering now at this point in time does not necessarily mean that you are going to be given priority when we open up 2 additional groups. So please do not overwhelm the system. Let the team focus on the most vulnerable. As a country, we have a very ambitious goal. And the goal that we have in Bermuda is to have 19,000 residents administer 2 doses of the Pfizer-BioNTech vaccine by the end of March. This equates to 36% of the population who are eligible to be administered the vaccine at this time, those that are 16 and over. This means, and as the Minister of Health discussed the scaling up of the vaccination effort, that as a country, we will need to work together to deliver 36,000 doses of vaccine over the next 10 weeks. This is an absolutely massive undertaking, but I have no doubt that we as a country can achieve it, as we've achieved many things over the past year. You may ask how we are able to make such bold claims and set such aggressive targets. That is because last week, the UK government, through Government House, informed the Bermuda government that an additional 29,250 doses of the Pfizer-BioNTech vaccine would be made available to Bermuda, with 19,500 doses expected to arrive on island next week. Again, that is an additional 19,500 doses to arrive on island next week. Earlier today, the Minister of Health briefed the Cabinet on the plans to expand the vaccination program to meet this very aggressive target. I am confident that we will meet this target, and I look forward to assisting the Minister of Health and the Ministry of Health as they work with all sectors, such as our local healthcare community and the hospital, to ramp up our vaccination effort to make this a reality. Again, our goal is 19,000 residents having 2 doses of this vaccine by March 31st, 2020. Again, a very aggressive target, but without question, one that we can achieve. And that would mean that by the end of March, 36% of the eligible population would have had the Pfizer-BioNTech vaccine. We'll now move on to the other piece of news, which I'm certain that people are eagerly awaiting, and that is to provide an update to the restrictions which are currently in place and the changes that will be implemented going forward. Today, in line with the Ministry of Health recommendations, which were blessed yesterday by the Cabinet Committee on the Coronavirus, the Cabinet has agreed to the following. First, group gatherings of persons in a private or public setting will increase from the current limit of 10, a maximum of 10, to a maximum of 25 persons. And this will also apply to outdoor funerals, who currently have a limit of 20, and that number will go to 25. Indoor bars and nightclubs can reopen, but will only be permitted to operate as restaurants are able to operate with table service only, with a maximum of 6 persons to a table. No service at the bar will be permitted. The Cabinet has also agreed to extend the curfew that is in place for a further 2 weeks between the hours of midnight to 5 a.m., with businesses closing at 11 p.m. Regarding large group exemptions, there will be no large group exemptions approved at this time. However, exemptions may be submitted for events taking place after February 1st, as the Ministry of National Security requires 2 weeks in which to process exemptions. These changes are set to come into effect this Thursday, January 21st at 6 a.m., and the restrictions, as always, will be reviewed on a 2-week period. It is very important that we recognize that through our collective efforts as a community and as a country, we've gotten to the place where we can relax some of these restrictions. However, it is important that we continue to remain vigilant. The only reason why we're able to do this, the only reason why the Minister of Health is able to report single cases numbers on various days, the reason why our real-time reproductive number is as low as it is right now, which is, I think, under 0.4%, is because we have been adhering to these rules. Please continue to observe the guidance. Please avail yourself of the free testing that is available in our community and obey the laws that are intended to keep us all safe, keep our economy going, and ensure that the vaccine program, which is essential to relaxing long-term restrictions, is able to ramp up and be effective. I do know that the extension of curfew may not be welcome news to many, and without question, it was a difficult decision. However, the Cabinet had to balance what is the most important goal at this moment for the country. As we're working on 2 areas, number 1, to ensure that any outbreaks continue to be managed, while at the same time ramping up our vaccination program, it's important to recognize that the same teams that are working on the vaccination program are the same ministry that is delivering on the monitoring of the health situation and preventing future outbreaks. It is important that we protect our healthcare system, and it is important that those persons who are dealing with those issues not be overwhelmed. It is vital that we minimize the risk of future outbreaks, and this will allow healthcare workers to continue to assist the government in scaling up the vaccination program to our very aggressive targets. Bermuda, we have shown that we can work together to successfully manage this particular outbreak. However, as I've stated, it is vital that we do not let our defenses down and become complacent again. This includes wearing masks, and I remind everyone that masks are still mandatory when in public, so please wear your masks. A further outbreak due to complacency would delay vaccination efforts and could lead to health and economic challenges for our country. As I stated in the past, we also use technology to help us stop the spread of the virus. And if you have not yet already done so, please download the WeHealth Bermuda app. It is easy to go to the App Store and ensure that this is installed on your phone. Last week, I was asked several questions about the WeHealth app. The app was officially launched on December 11, 2020. The first code out of the system was issued on December 22nd, and I was asked last week by Ms. Maya Palacio of Media Maya how many codes have been given out in comparison to the persons who have tested positive. Thus far, there have been 29 codes given to individuals who were confirmed positive since the codes were first able to be issued. In that time, there have been 84 confirmed cases that were not imported cases. So these are not cases that were caught at the airport, et cetera. These are persons who would be assumed to have contacted those through local transmission. So they're either under investigation or under local transmission. And so this means that 34.5% of confirmed positive cases were able to have a code issued. Certainly, we want to make sure that number gets higher, and it is vital, especially as we're moving to a place where bars and nightclubs will be able to open with strict restrictions, that we make use of technology to minimize the chance of future outbreaks. Additionally, Mr. Trevor Lindsay of TNN asks how many people received notifications that they had been near someone who tested positive. Unfortunately, we are unable to supply that data. The app is designed to provide notifications about a positive case anonymously. We asked the developers for the number of people who had received exposure notifications, and the app developers said that there is no way for them to get who gets notified of exposures. This is intentional and a key part of how the privacy model works. When an individual receives an exposure notification, they are the only person in the world who knows that they are notified. As I've said before, the app is free. Please go ahead and download it. And I strongly urge, if you are going to take advantage or go out in line with the new change restrictions, which will come into place on Thursday morning, please ensure that you have the application installed, especially if you are going to a place where groups of persons may congregate. It is vital. I will now discuss the economic measures announced by the government to help us continue to stimulate our economy. On November 16th, following the throne speech, the Minister of Public Works, David Burt, announced a short-term economic stimulus program in partnership with the Bermuda Economic Development Corporation. The aim of this program is to provide jobs for Bermudian-owned businesses and also to provide much-needed upgrades and improvements to the island's infrastructure. This is in keeping with government's commitment to support small to medium-sized businesses through these challenging financial times, and our commitment to use capital stimulus in order to help our economy. The economic stimulus program is consisting of 40 different projects, where the government intends to use as many local businesses, trade persons, and contractors as possible. The Ministry of Public Works will ensure allocation of funding and opportunity for work is spread across the various businesses within the program, and we strongly encourage Bermudian-owned businesses to apply, particularly small to medium-sized enterprise. We understand that there may be small businesses who are not familiar with the processes required to apply. We want these businesses to have the opportunity to get access to this work and not be deterred by the application and documentation required. The BEDC will provide assistance to small and medium-sized businesses to ensure that they can confidently submit their application and be involved in the stimulus program. This is not just about large construction companies. We are looking for local businesses who provide various services related to the construction industry, from large projects to water heater repair, plumbers, AC installation, dock maintenance, tiling installers, painting, just to name a few. If you or a family member or friend have a small business, it may be only one or two of you, whether it's things such as bathroom remodeling, roof cleaning, whatever the small thing is that you do, the trade of which you are an expert in and the business of which you are involved in, please go ahead and apply. Again, there are 40 different projects which are ranging from a number of different items, and there are persons who can be used as a number of these projects are going to run simultaneously. Please, small businesses, use this opportunity to take advantage of this so that you can have more business for your company. The deadline to sign up is February 15th. And if you are a business that wishes more information, please go to the BEDC website, bedc.bm, to learn more and to register for the virtual information sessions. As I close, we are taking another step forward in our fight against COVID-19 with the expansion of our vaccination program and a second batch of vaccines on the way. Public schools are back open and receiving students. We are implementing a program to help boost our economy, to get Bermudans back to work, and to rebuild for the future. There is much work underway, and certainly much more work to be done. But I am hopeful that if we continue to work together, make responsible decisions, adhere to the guidance, and get vaccinated when possible, we will continue to progress as a country. Bermuda, with the rest of the world, has been living with the coronavirus for almost a year now. This has brought unusually high levels of stress for many. Some have lost loved ones, some have supported family members and friends who are confirmed positive for the virus, and there are many who have lost their jobs due to no fault of their own. We know that there are many in our community who may need extra support emotionally. Please, if you need someone to talk to, take advantage of the Bermuda Psychological Association hotline and the Emotional Wellbeing hotline. The number is 543-1111. Again, 543-1111. And the line is operated every Monday to Saturday from 5 p.m. to 9 p.m. And there is someone there to speak to if you're feeling anxious, if you're a senior who may be feeling isolated, if you're a caregiver coping with family members with dementia, or if you are not feeling yourself. The phone number again is 543-1111. Finally, to make sure that you get accurate, reliable information directly from the government of Bermuda, please subscribe to the government's WhatsApp service. That phone number is 504-6045. Again, 504-6045. All you have to do is go into WhatsApp and send hi to that number, and you will receive updates directly from the governor of Bermuda. I'm now happy to take questions from members of the media.
We'll start with the Royal Gazette.
Before we take the question, Sarah, there's just one thing that I didn't mention in my speech, and it's not a slight to any members of the media, as I know we're going to get a lot of questions today. I know without question that there's been a lot of various questions which have come from various media houses that have asked for all measures and slicing and dicing of statistics related to the vaccination program. I'm asking members of the media to certainly be patient. The minister was able to give a number of different statistics today, but what we are doing is making sure that the team at the Ministry of Health is focused on ramping up the vaccination efforts. If we take people off the vaccination effort to start parsing statistics and other matters, it will delay the vaccination effort, and the most important thing is to scale up and ramp up the vaccination effort. We will be reporting statistics in the weekly press conferences, and in the coming weeks we will establish a website where all statistics will be able to be seen and will be able to be updated on a regular daily basis. But until we get to that point, I'm going to ask members of the media to be patient. There's been so many different questions that have come in asking for various slices and dices of the vaccine information, and there is just not the resources there to do that without taking people off of the vaccination program, making sure we go through the screening process, et cetera. It has been a quick ramp up. It has not been without its hiccups, as the Minister of Health has said and indicated, but we are certainly there where we're running a more efficient process, and I ask members of the media to bear with us for those specific stats. Thank you.
Thank you. I think you might have preempted me there a little bit.
No problem. I just want I want you to make sure that your 6 questions you're not going to get.
Exactly.
We'll have to get back to you later.
Because I did
It's
have some
important.
questions, about, emergency workers and the overall number, and that there are, how many have given consent and how many have been vaccinated. So I'm guessing that is what you're talking about, those kind of statistics.
There's a number there. I mean, the Minister of Health will answer and revise, I guess, some of the things in her statement. But what you're looking for us to do is actually data analysis. And it's to take the total amount of emergency workers, compare that to the amount of emergency workers who have submitted a form, so it's to parse that data, and then go about, providing that an individual statistics. And it is actually a data exercise. Though we can recognize the people who are in essential services, it's not as though if all the people came into the vaccination system the same way. So, for example, if everyone went through the online form and all those things were filled in, it would be easier to parse that data at some point in time. But the service members gave their information directly, that was entered directly to the system, so there's a significant data exercise that is attempted to be done. I recognize the reason that the questions are being asked, but the fact is we are just not able to provide that information. It's not for us being obfuscating, it's just the priority has to be to make sure that we can keep up the vaccination program and accelerate the vaccination program.
And ultimately, what we're trying to obtain is herd immunity. So if we can get up to 60 to 70% of our population, our preference would be the majority of essential workers and healthcare workers and frontline workers. But 60 to 70% is our objective because we want herd immunity. How we get it is of less consequence.
So we did get some statistics at the Royal Gazette from BHB staff that sign-up is actually quite low within the healthcare community, working community. So we had a figure given that there's 1,900 workers, 650 of them gave consent to get the vaccination. Now, is this disappointing to you? Shouldn't healthcare workers be leading by example?
I agree with you. Healthcare workers should be leading by example, and what we've seen in the last week is a number of them stepping up to the plate and being vaccinated. You'll appreciate that of the 1,900 BHB employees, many of them work in back offices, in the kitchen, in the laundry, environmental services, and the like. But they have had a very good uptake on persons that are frontline, ER, ICU, nursing staff, doctor staff. So that 1,900 encompasses a lot of people that don't necessarily fall into the classification of essential workers by virtue of the nature of their role.
Yeah, so it's not accurate to take that 1,900 figure and say that only the 600 are, because remember, as the Minister of Health has said, it's frontline healthcare workers. So not just every single person who works for Bermuda Hospitals Board, it's frontline healthcare workers are the ones that are being prioritized in phase 1A.
Sure, okay. As part of the application process, there is an option to list your race, as you have mentioned tonight. And before, when you launched the program, you had mentioned vaccine hesitancy within the black community. Is this the reason why you're collecting this data? If not, could you elaborate why?
Sure. No, you're absolutely right. When we did the survey, the omnibus survey in December, we noticed that there was a higher percentage of persons within the black community that were expressing vaccine hesitancy and not wishing to be vaccinated, certainly not in the initial stages. So part of the collection of that data is so that we can, as you've indicated rightly, first of all, it's not compulsory. We're asking persons to put that information in, but it is not compulsory, as you rightly said. But part of the reason that we're collecting that data is so that we can effectively see how our messaging needs to be developed. Do we need to go into the black community, to the churches and other organizations to try to encourage persons to become vaccinated? Because again, as I said previously, we want to get to herd immunity, and that requires 60 to 70% of our population.
And also, if we don't have collect the data, we won't be able to answer the questions that will inevitably be asked, like
Yeah,
they were last
exactly.
week.
What's the race?
And I believe it was Don that had asked at the time when you had mentioned it during the launch of the vaccine, whether it was to do with, whether there was a legacy issue to do with this. And you said, yeah. Could you just elaborate on that a little
I
bit?
mean, it's a complex legacy issue. Black people are distrustful for good reason of medicine. I mean, black people have been used over history for experiments, you know. I mean, as recently in America in the, 1970s, where low-income black women were given unwanted sterilizations. That is historical. I think there was a really good video that I'll make sure is played on CITV, which I think was from a news program, where they were talking about these issues and talking about the challenges that are faced inside the black community. But the real challenge that I have with that, Sarah, is the fact that it is understood and noticed. In Bermuda, we just, we go with black persons, but in America, they go with communities of color, and that's the language which they use. But the fact is that we have seen, whether it is in regards to our death numbers, in regards to the persons who are more likely to be impacted by the coronavirus, we see that without question, those persons are predominantly persons who are black, or in America, as they'll say, communities of colors. And those are persons who, in the exact same way, are more hesitant to take the vaccine, which will actually protect them. mRNA vaccines are a marvel of science. To have vaccines that are proven to be 95% effective in initial trials, safe and effective, being able to be administered, is a marvel of science. And that is why we're going to continue the work to encourage. I am hopeful that as time goes on, as people will see that the Minister of Health and I are back here week after week, not with anything crazy going on, more persons inside their community, family, etc., those conversations will continue. And I know that also the fact is that there will be persons who do not get vaccinated. And the persons who do not get vaccinated will be at risk. And some of those persons who do not get vaccinated, they will catch the virus, their family members will catch the virus, and some may even succumb to the illness as some have done so. So it is a difficult thing. We are going to be real and honest. I think that's the communication that the public wants and is deserved from their leaders, and we're going to continue upon that path. It is important that we take advantage. Bermuda will have the opportunity to have over a third of the population that is eligible to receive a vaccine, to have that vaccine before the first quarter of this year. That is amazing, and we have to work together to do it. And that is the reason why we're going to continue to encourage all segments of the community, but especially focus our message on places where there is vaccine hesitancy, as it's important to get those numbers up.
Okay. Is there an antibody test, and if so, is it going to be used in Bermuda?
Doing antibody testing for some
Yeah,
time.
they're doing that at Southside, MDL, I mean.
Sorry. If you have the antibody test, do you still need to get the vaccine?
Oh,
Is it
absolutely.
Still
Yeah,
recommended that you
absolutely.
still get the vaccine?
The recommendation from the vaccine, as the Premier indicated, it is, they're showing 95% effectiveness, and that if it reduces the likelihood of somebody actually having any of the symptoms of COVID and or death. So the fact that you have the antibodies in your systems matters not. We're still encouraging and recommending, as the science and the doctors community are indicating, that people get vaccinated.
Sure. And we had received some reports of people getting calls to get to the vaccination centre ASAP, as half of police officers hadn't shown up on one occasion, and the vaccines were going bad. Is there any information you can share on this? Is
Okay.
this correct? Or
Sure,
any
I won't
truth
say
in it?
anything. Let me start. I don't know about half of the police officers not showing up. As I understand, there's a significant amount of police officers that have been vaccinated. However, what I can say is that we have seen on occasions where people do not show up to their appointment, which is, let me just use that as a perfect segue to say it's really critically important. If you have an appointment scheduled, please show up. Because, as I indicated, when you open the vial, they need to use those 5 injections within the day that it's been opened. So in circumstances where, for example, persons do not attend to their scheduled appointment and the vials have been opened to service other people that did attend, they need to utilize it, which is why we have that list of persons that can get up there as quickly as possible prior to the center closing, so that we are not wasting. Because in addition to us wanting to vaccinate 60%, 60 to 70% of our population so that we can acquire herd immunity. We also do not want to find ourselves in a situation where we're wasting valuable vaccine materials.
And that list that you speak of, how is that created? How is that prioritized?
It's doctors will indicate persons that may have medical vulnerabilities and so forth that may not necessarily be in phase 1 or 2. It's populated by doctors. It's populated by other persons that are maybe not necessarily in essential services, but back house of the police, for example, as opposed to an essential person. There's a number of persons that are on that list, but in addition to the criteria, it's also, we have to recognize that you have to be able to get there kind of quickly, because it's effectively, if they wait till 4 o'clock, so the vaccination, I think the hour's until 3 actually, so that last half an hour, if they notice that there's 4 doses because people haven't shown up, then they're going to call people and say, can you get up here and, get the vaccination, so they're not wasting it.
And have there, finally, there's been cases where someone has taken perhaps an elderly relative up to the vaccination centre and been offered out of the blue whether they want to take it too, not anything to do with this list. Can you speak to that?
We are aware of a few isolated instances where that has occurred. As recently as today, I've spoke to the team and we've indicated that we need to reinforce the fact that we will not be taking walk-ins. So even though you may be accompanying a person, an elderly person, if you don't yourself have an appointment, then you will not be able to have the vaccination until you have received an appointment. Not only does that create a bottleneck, but it also creates obviously unease within the community where persons are deemed to jump the queue, so to speak.
But it has happened.
Yes, we're aware of that.
Yeah.
But again, I've reiterated to the team that we will not be taking walk-ins. If you are coming to assist somebody because you're their caregiver or you've given them a lift, if you do not have an appointment, you will not be vaccinated.
But in the cases where those few cases that you spoke of, why did it happen?
Pardon me?
In those few cases that you said, yes, it has happened a few times where somebody walks in with an elderly relative and they get offered it. Why is it happening?
I'm aware of one particular case, which is probably the same one that you're referring to, and that was on
That's
Facebook.
actually not.
Well, in any
don't
event,
believe it's just the only one, but yeah.
I'm personally aware of one particular case, and as I understand it, upon further investigation, the nurse did say, "Oh, would you like to have a vaccination?" And the person said, "Well, I'm not ready. I'm not ready. I'm sorry. I'm not part of 1A or 1B, so it's not my turn." And they went ahead and administered the vaccination anyway. But again, we have indicated that we will not be taking walk-ins.
Okay, thank you.
Thank you. Maya?
Good evening, everyone. Maya Palacio here for Media Maya. My first question actually has to do with a community question asking about the guidelines, just to confirm the date of it, when the Cabinet Committee might be meeting again to revisit the restrictions, and I'm assuming they're mostly talking about the curfew restrictions, seeming that it will be in place still for another 2 weeks, so they want to know when would the Cabinet be revisiting that.
In 2 weeks.
So February 1st? I think that's what,
The cabinet meets every Tuesday.
every Tuesday.
We've kind of got on a pattern where we come here on Tuesday, and the changes go into effect on Thursday morning at 6 a.m. So the cabinet meets every Tuesday, and we said that we'll review these in 2 weeks. So the cabinet committee on the coronavirus will be meeting 2 weeks from yesterday. I can't do that math that quick, but that might even be February 1st.
Yes, that might be. Wait, Tuesday you said, so today?
The cabinet committee
Met-
meets on Monday.
Mondays, sorry.
And makes the recommendation to the full cabinet, which meets on Tuesday. So the cabinet committee met yesterday, received the matter, had the conversation, discussion on issues, and made the recommendation to the full cabinet on Tuesday. So the next cycle of that will be the cabinet committee, I'm assuming, will meet on February 1st. The cabinet will meet on February 2nd. And we may come here to give the update on that particular evening.
Thank you very much. My second question to you, Minister of Health, if you could just repeat the color codings and the days again for when the wristbands will be put in place from Monday, January 25th.
It's interesting, when I was reading through that, I actually had you in mind, because then that was a question that you had asked. So it's consistent with the Travelers Continuum, the 14-day Travelers Continuum, which is online. And the travelers arriving, on arrival will receive a red one. On day 4, the red one will be changed to orange. And on day 8, the orange will be changed to yellow.
Thank you very much. My next question actually had to do with, since Monday, January 11th, till today, Tuesday, January 19th, we've had 31 new positives, and out of the 31, 23 were imported cases, classified as imported cases. Does that concern government at all, or not really?
Well, whenever we have cases, it's obviously a concern. It's interesting because a few weeks ago, of course, our biggest concern was the fact that as a result of certain activities that took place the last weekend of November, we saw 2 magnanimous outbreaks. Now we are reverting to seeing cases that are becoming imported. The cabinet is in discussions with respect to the criteria for entry. You'll note that the United Kingdom, we have imposed restrictions for persons that are traveling directly from or via the UK to Bermuda, that there's a requirement for them to have 4-day quarantine, and whether or not that same provision will be applicable to other jurisdictions is what's being discussed.
Thank you. And my next question for you, Minister of Health, is about those persons who have been vaccinated and have the COVID-19 vaccine. What type of requirements or laws will be changing in the terms of like pre and post arrival visits when flying to Bermuda? Will there be any
The person's
difference?
coming in. Again, and that's a very good question. Thank you for asking that. And those are discussions that we're having because we recognize that some of the criteria that we have with respect to testing and so forth, which is very stringent, and we probably have one of the most aggressive testing regimes in the world. Certainly we're one of the top 4, I think, for testing, but we are looking at that. So if a person has received and has confirmation that they've received the 2 doses of the COVID vaccine, whether or not they would have to adhere to the same testing criteria of day 4, day 8, et cetera, is what we're looking at as we speak, because that's an important feature, particularly for persons that want to visit Bermuda. If they've already received the vaccination, then they want to know, well, do we have to have as many tests as is required? And we are actually having active discussions concerning that.
When do you think there might be an update on that?
I would like to say certainly within the next couple of weeks. Remember that the evidence concerning the vaccination, it still is relatively new, so we know that persons that are vaccinated, there's no evidence to confirm whether or not they still have the ability to transmit it to other persons. So those are certainly features that we have to look at, but we are definitely actively engaged in those discussions because we recognize that if persons are vaccinated, then the traveler continuum and testing continuum should be a little bit more relaxed because they have received the vaccination.
Okay, thank you very much.
That, Ms. Palacio, is that in Bermuda, we started administering vaccines last week. That means that we will do the second round for persons who had their first round last week. In the time following, 3 weeks afterwards, the vaccine takes a full 2 weeks after your second dose to be effective. So our timeline for the introduction of those matters of which you have laid out will be regarding the middle of February. So we'll be able to announce the implementation. It will be announced a few weeks beforehand. The most important thing is that as we recognize resources are certainly limited, and so what we want to ensure is that the teams at the Ministry of Health, though we do want to make sure that we roll out what those things are, we know that the teams over there are making sure they're putting any and all efforts into the necessary vaccine ramp-up. But the target time for that will be before the middle of February when we intend to implement it, as we'll have people who would have been able to, by that time, have received 2 doses of the vaccine here locally and for it have been effective.
All right, thank you very much. Good time, middle of February. And my next question, again for you, Minister of Health, pertains to the vaccine that we actually had, the Pfizer. Have there been any conversations about trying any of the other options for the COVID vaccine?
The COVAX facility has indicated to us that they will probably be supplying us with the AstraZeneca or the Moderna, but I cannot say with absolute certainty which one it will be from the COVAX facility. And as the Premier indicated, we'll be looking to get more of the Pfizer supply from the United Kingdom as early as next week. But it is very likely that the other 2 available vaccines from the COVAX facility will be what will be supplied to Bermuda.
Okay, awesome. And with that being said about those vaccines, so which one, if you by any chance know, would be like more economical for the island actually to take on?
Well, the Pfizer one is quite is costly simply because of the need for it to be refrigerated, right. So some of the other ones don't require that same degree of refrigeration, as well as they have a longer shelf life.
So why didn't we get the other ones before then?
Because we wanted to get what's first was made available.
Ms. Palacio, I do not want to quote the director of the general of the WHO, but the fact that Bermuda has been able to commence a vaccination program where a significant majority of the countries in the world, I almost want to say it's probably about 90%, have not had access to any vaccines at this point in time is one. And so the question is whether you take what you can get. We have been fortunate that we have been given doses, which the United Kingdom has ordered in proportion to that, what they've gotten, and we're fortunate that we are going to be receiving more doses, which will allow us to significantly scale up our program. But we are in a fortunate position, and I think that it's it's an important conversation, an important discussion when you recognize that there are persons in very many countries who have not had access to the vaccines, and those are countries that have been worse affected than Bermuda has. So we are very fortunate to be in this position, but I think it's important that we keep the total picture, recognizing that there has been very few countries that have been able to commence the vaccination program due to the supply of the vaccine.
Awesome.
Can I just also add, that the Pan American Health Organization actually commended Bermuda last week with respect to our vaccination rollout, comparing us to other countries to our south, and said that we were certainly gold stars.
Also, I was just about to say, then that's really great on our government to be able to get that for our people in such a great time frame. And my next question was actually about the vaccine hesitancy.
Well, you got a whole lot of questions tonight, Maya. Go
Oh,
on.
my bad. I'm sorry. I thought I was doing follow-ups. I just didn't say it. Oh.
You had Don giving you looks there.
I'm sorry, Don. One last question, though, just about vaccine hesitancy, because you said the number of the stats today that only 14% of the persons who have registered were Black. I guess my overall question to you would be, Mr. Premier or even Minister of Health, how can we, not move past, but overcome maybe the vaccine hesitancy in the Black community? Because obviously most people in the Black community know about why we are distrustful of medicines and doctors and things from the past, being that experiments, or even here in Bermuda when it came to the birth control reduction of Black families in 1936. I've been doing research, and I was just curious to know how we could get past it, because it's not even taught really in schools as to why this is an issue, and some people don't even know why there is a history and why there's an issue.
Right. I think one certain mechanism that we can use is people like you, because you obviously have a very big following. The press obviously have the ability to educate people and remind persons of not only the importance of vaccination, but to look at the science and look at the evidence that supports vaccinations and why it's necessary to get vaccinations. So I think that if we can use our media outlets to help to support the message, speaking of the science, as opposed to ignoring the fake news, I think that it can go, quite a long way by persons such as yourself to help us get the message out there, not only of the importance of vaccination, but the fact that they're safe and that people should use reliable sources for gathering their information, as opposed to things that are not reliable and not based on scientific evidence.
Yes, and Prima, I guess we all know, for the most part, know the history of why we are distrustful. So can you tell me exactly what made you feel comfortable with taking the vaccination?
You want the complete and 100% honest answer?
Yes, sir.
I asked Dr. Weldon if it was safe, and she said yes, and I was good to go. That's all I needed. This is my science advisor to tell me. And it was a conversation of certainly which we had, but it's a conversation which we're having in a lot of families. And that's what it is. And the unfortunate thing is that nowadays, anyone in their basement can make a video. Anyone with a thing can make a video. And, it doesn't matter if it's factual or not. It doesn't matter if it's fake. It doesn't matter if it's somebody who hasn't gotten any type of vaccine and shot sitting there and convulsing and all the rest just to scare people. And we have to remember the international political environment in which we are actually in. Disinformation on an international scale is real. And there are certainly governments around the world that will take pleasure in fomenting social division and other divisions inside of countries. We can just look to the United States to see recent examples of that. And so we have to recognize what's there. So we need to trust each other. The Minister of Health and I, we are good messengers, without question. We were willing to do what we're asking the people of the country to do. But what's most important is to talk to your doctor. And through the vaccines program that is every week on CITV, there's going to be more and more doctors that are going to talk about the science, talk about why it's safe, talk about why it's necessary, and talk about reducing those fears. So we're going to continue to have those conversations, I said. I've had those conversations with my friends. I've had those conversations with my family. And the message is just to continue to overpower the negativity. Because the negativity is there. Skepticism is healthy, without question. But I think that in a place and case and instance, I listen to medical professionals and people who know science versus persons or some video that someone who doesn't know anything about science forwarded me in a WhatsApp chat.
Thank you very much.
Rebroadcasting?
It's your turn, Don. So you've got your football mask on. West Ham won again today.
Yes. Good evening, Don Burgess, Bermuda Broadcasting. Mr. Premier, you just announced a tremendous goal to scale up the vaccination program, and it's possible to think that Bermuda could even lead the world soon. However, to date, Bermuda has only averaged a few hundred injections per day thus far. Cayman is apparently more than 3 times higher than Bermuda. How do we plan to get the daily vaccination numbers up quickly before the new supplies arrive next week?
Well, the one thing that I can say is that the Minister of Health, as I indicated in my statement, has outlined what the scaling up of the vaccination program will look like. I know that the hospital has been focused on delivering and making sure they take care of those things, and also their staff at the hospital and also the long-term care facilities, making sure that we increase the vaccinations there. But next week, the intention is to bring the hospital online as another site, to expand the hours of the existing site, to make sure there is more days, and to make sure that we greatly expand the amount of persons that are being tested. The Ministry of Health is confident that we're going to be able to meet those targets, and I'm not going to be judged by anyone else's targets or what anyone else is doing. What I'm going to be judged by is making sure that we can do this right and proper inside of our country. I think that we've had a great start. We've learned some lessons in the early phase. The rollout could have certainly been smoother. The Minister of Health and I have both admitted that. But now I believe that we are sufficiently poised, working out some of the challenges which we had to get there. And I have absolutely no doubt that we'll be able to scale up that vaccination effort. We have doctors that are coming online to support and extend hours. As I said, with BHB, we have persons of the community, health professionals expanding. It is going to be a community effort to get there, but I have no doubt that we'll be able to make that target. It is incredibly aggressive. I do not believe that we'll be the most vaccinated country in the world. I don't think anyone is catching Israel, but that's a different conversation.
Today, the U.S. announced the grim milestone that the nation had surpassed 400,000 COVID deaths. New variants are evolving and spreading around the globe like wildfire. Are you going to begin vaccinating people 7 days a week in Bermuda?
Part of the vaccine rollout will include an extension of hours, an extension of the location, as well as the extension of the days.
Okay, thank you.
I don't think we're going to get to 24 hours a day,
Okay.
but we are going to hit that target.
There have been healthcare workers, just to go back to that topic that Sarah brought up, and essential workers who have contacted BBC and said that they have applied for the vaccine but have not heard back from the health department. How is the health department staff processing the list of names of essential service workers and healthcare workers?
As I indicated, actually, Don, when we received the applications from the essential services, though we are still in phase 1 and 2, there are some persons that are in essential services that may be more vulnerable than others. So the medical team are actually assessing the applications. So let me just give you an example. One person that works in essential service A has a comorbidity. Another person of the same age works in the same building and doing the exact same job, but they don't have that same level of comorbidity or medical vulnerability. then the person A is going to be able to be accessing the vaccine first because they are a more vulnerable, necessary individual because of their medical vulnerabilities. And as I also indicated, many times we can't tell by looking at somebody if they have any type of chronic conditions, right? We can tell if somebody's overweight, but we can't necessarily tell if somebody has any other type of chronic conditions, which would necessitate elevating their level of vulnerability and their level of triage insofar as who gets the vaccine first. So we are encouraging everybody to register, but the medical team are actually looking at the application. And if you look at when you actually register online, there's a number of drop-down menus that speak to different chronic conditions. And they're looking at that when they make the assessment insofar as how they're triaging who's prioritized concerning the vaccination. Now, I have to admit that this is a process that up until not quite 10 days, not even a week ago, we didn't know when we were going to get our next shipment, right? Things are changing drastically now that we know that we have more vaccine. Right now we only have the ability to immunize 4,700 people. Now that we know that we're going to have more, we are going to be able to move to phase 2 and phase 3 a lot quicker because we have more. And I'm not saying that we're not rationing, but we were trying to prioritize, and we still are continuing to prioritize, but we also have just been, as the Premier indicated, have received word from Government House that we're expecting a very, very large supply, larger than what we got the first time, very, very soon. So we'll be able to immunize more persons. We're, as I've indicated, also upgrading how many, the facilities, how many people are going to be vaccinating persons. As the Premier indicated, we've got doctors on board that are prepared to work evenings so that we can work into the night at our vaccination centers. We've gotten veterinarians who have said we'll come on board and assist with respect to that. Pharmacists, this is a community effort, and we need if we want to get to herd immunity, which I believe that we do, we need the community involved. But as it relates directly to the question that you've asked, we can't tell by looking at people what type of chronic conditions or medical vulnerabilities that they have. But the nurses are assessing that. In some jurisdictions, they do have a chronic disease register, so that information is electronic. They have electronic medical records, so they can actually push a button and say everybody that has high blood pressure, and then it spits out the 450,000 people that have high blood pressure. We don't have electronic medical records right now, so it's a manual exercise.
Okay.
If I just may add to
Okay.
that, Don, because I think that it's important, and it's important that we keep all of these things in context. I would just encourage that the essential workers that are contacting BBC to just be patient. Last week we didn't have vaccines. We are working through the process. There are a whole lot of persons, and we are doing it. We are working through the process. Do I wish that we could be faster right now? Absolutely. Everyone wants to. But the fact is, the Minister of Health said, we're working towards a certain target. Now that target has expanded, and we're going to make sure that we can expand it. There may be less rigorous checking for essential services as they were doing the prioritization of what's it called, because now we know that we're going to have a greater amount. There was a point in time, 2 weeks ago, when we had asked Government House for any further indication of when any future vaccine shipments would arrive. They were not able to give an answer. So we were under the impression that we would only have these 5,000, of which that we had to decide on how those were going to be allocated. As I said, last week, Wednesday, we were given the indication that we were going to get more, and the dates were yet to be confirmed. So that's where we pivoted and went to how can we scale up, what are the things in which we have to do, etc. So I want to make sure that everyone is remaining patient. As the Minister of Health has said, the effort is going to be scaled up dramatically now, as we have to make sure that we get those doses in the arms before the end of March, and we're going to do that.
Okay, thank you very much. Minister Wilson, we've raised this before, but public school children, especially this week, who've been in bubbles all day at school with physical distancing, are now getting into PT buses, and I guess next week will be back to minibuses, but getting into PTB buses after school and are mixing with children from different bubbles and grades with no physical distancing on some of the buses. Your comment on the situation?
Well, I think it's important to note that children in school probably, 6 or 7 hours a day, so it would certainly be more beneficial for them to remain in bubbles because they are in that particular environment for an extended period of time. I think the average person on a bus is probably 20 to 30 minutes. So we appreciate that they need to be transported here and there. The buses are requiring, as the law does, for children to remain in their seats. They're not permitted to be on their phone. They're supposed to continue to wear their mask, as the bus drivers are wearing as well. So with those type of parameters as it relates to guidelines, you know, we have to operate and they have to get to school. And I think it's more important for the children to be able to ensure that they're in school so that they're learning and engaging in interactive activity and socialization, et cetera, which is important for a child's development. We are more concerned about the fact that they are in school for 7 or 8 hours and not in a bubble than we are the 20 or 30 minutes that they are transported from the school to their home.
But previously you said like close contact would consider 15 minutes. So if they're on-
That is still correctly the position, but we have to balance it. At this point, you know, we do recognize what we said, that, you know, cumulative 15 minutes is close contact, et cetera, but we have to strike a balance. I don't think anybody in this room would disagree with me that children need to be educated. They need to be socialized. We need to allow that for them to continue having the benefits of going to school. And the reality is many children can't get to school unless they have a public use of public transportation. So it's a balancing act. Them being in class in a bubble is far more important because they're in school for 6 or 7 hours a day as opposed to 20 or 30 minutes to be on a bus.
Okay, thank you. Have any further barriers been revealed that might prevent us reaching herd immunity? And is Bermuda limited by the size of the special cold storage freezer needed to store the Pfizer vaccine?
We have absolutely no limitation with respect to the required requisite freezer space. We have sufficient storage. In fact, not only do we have sufficient to store what we have and the anticipated doses that were coming next week, but we also, I believe, any day now, we ordered 3 extra freezers. So we have far more capacity than is necessary. Secondly, yes, I'm sorry. What was the second part of your question?
Any further barriers that
The biggest barrier that we have is the vaccine hesitancy. And I think that's primarily based, in addition to what the Premier said, there's a historical element to that, but also there is a lot of misinformation. And we're just encouraging people, if in doubt, just ask your doctor.
Take medical advice from a doctor. Don't take medical advice from the internet. Don't take medical advice from WhatsApp. Don't take medical advice from talk shows. Take advice from your doctor.
Premier, we are using the newest and most efficient. Are we using the newest and most efficient syringes, which limit dead space within the needle, and thus eliminates wasted vaccine left behind the inside of the needle, and so maximizes the amount of vaccine available to the public?
I'm very sorry that Dr. Armstrong isn't here, but hopefully the Minister of Health will be able to answer
And
the question.
she provided the answer for me, actually. Obviously, the objective, in addition to getting herd immunity, is to minimize wastage. So the proper vaccinated syringes that are being required for this particular vaccine is what's being used so that we can certainly minimize wastage.
Thank you. And my last question. The United States on Monday is going to start requiring people to have a pre-test before they go. And I know that Dr. Weldon, when I was speaking to her on Friday, stated that Bermuda's looking at charging people who are going on vacation, because also Canada and the UK are requiring pre-test. How is that going to be done? How are we going to determine who has to pay? I mean, because currently on the form when you sign up, there's no reason as to why you're getting the vaccine. You just sign up.
We haven't finalized the parameters of that yet, but we're looking to finalize that so that we can make an announcement in time. Certainly, as I think was indicated, a significant majority of travelers already are able to fit with the time scale, the testing time scale which they have. Most of them are able to fit in to that time scale in time for their travel. But it is still something that we're finalizing. There's been a few discussions, and you should look forward to an announcement on that certainly before the end of the week. But it is certainly something that is important that we're looking at. But from a tourism perspective, we are making sure that we remain open to limited visitation travel, but to support our hotel industry. And the truth is that Bermuda is in a far better position than other countries because we have the ability to do this testing capacity. A lot of other countries are now having to figure out how to scale up their testing capacity in order to keep their air routes open. From Bermuda's perspective, that's not a challenge that we have because we have the testing capacity, so we can support these already. And it's already in place for the UK.
Okay. And with that, how much has Cabinet discussed how much they're going to charge
Decisions
residents
have
to
not
go?
yet been finalized.
Okay, thank you.
Thank you, Don. Premier Sarah from the Gazette has one more question.
Just one other quick question. Have there been any wasted doses as yet?
Not to my knowledge now.
Okay. The question was, have there been any wasted doses? And the Minister of Health answered,
That's why we're calling people at the end of the day, and we see we got 2. Whoever can get here in 5 minutes, then they're able to receive it.
Okay. Thank you, Minister. Premier.
thank you very much, honey. Thank you, Bermuda, for your attention. Thank you to the members of the media for their questions. I know that there was significant amounts of information of which was shared today, but it is certainly important. The good news is that we have additional vaccines which are on their way, and we're going to be expanding the vaccination program. We ask all persons to be patient and to be mindful with the changes that are coming to place on Thursday morning at 6 a.m. to remember that it is important that we remain vigilant as we are far from out of the woods yet. As we are seeing numerous cases throughout the world, as we are seeing different challenges that are in other jurisdictions, let us make sure that we continue the work, energy, and effort of which we've employed to date so that we can minimize the impact that this virus has on our island while we scale up our vaccination effort. So I want to thank you for your attention, and good night, Bermuda.